under the unemployment extensions.
Right.
Yeah.
You know, you're talking about somebody drawing unemployment?
Right.
What if they're off unemployment?
It doesn't,
Then they don't have
We
it.
keep forgetting about the people that are beyond unemployment.
But see, I think that's where we need to keep remembering. If we move to a system that actually gives you ownership of your health care, and it becomes true health care coverage as opposed to insurance that's there, undoubted, and will be tapped into, and the cost as a result of that will increase. Plus the other factors that are there we have to cover against. The uninsured, the emergency room, a person who comes in with no other recourse, the uninsured individual, the liability, frivolous lawsuits, all of that. If you can deal with those, and you and I both can have an insurance plan that we make a conscious decision on what it's going to be, we have it in place, it's prepared for the future, and we accept what we paid for it. I think we start to reduce that cost, and I become a consumer with my doctor as opposed to just a number with an insurance card, whether you're government supplied, business supplied, or don't have it. The idea that this plan has here that says you've got to have health insurance, but you don't have to have it until you need it. Well, that's not insurance. That's all of a sudden I can find out I've got a problem, and so I buy insurance. How do you as an actuary prepare for that? So you just up your cost, or you go out of business as an insurance company.
It's interesting with the new health care law that they call it health care reform, but there's really nothing about it that is health care. And you probably alluded to this before I came in, because it mandates that you have insurance or that you pay a penalty. And it mandates that insurers may do or can do certain things, but there's nothing about that that says that you are going to be covered if you need something. And for so many people that were so concerned about the taxpayers picking up the tab, when and if, somebody got sick and they go to the hospital and now they're on Medicaid and the taxpayers are picking up the tab, now Medicaid is going to be expanded so much that the taxpayers are going to pick up even more. And here again, like I read the other day, a lot of places aren't even taking Medicaid. So for the people that are up to 133% of poverty that'll be on Medicaid, they're not going to get anything.
Yeah,
So really, there's nothing there that they're getting.
When Walgreens comes out and says we're not putting Medicaid prescriptions.
Yeah. Or I heard that dentists don't take Medicaid, There's nothing there that gives anybody anything that they thought they were going to get. So for them to call it health reform is just nuts.
Or when you tell a corporation that you've got to have this level of coverage for your employees, you pay the penalty. And they look at the penalty as being more accessible to pay than bringing up what they are paying presently.
Or if they cut you the
And they walk away and they pay the penalty, they make out and they keep some jobs. Otherwise, but the people lose.
But the people that go on the insurance plan, the government doesn't have the insurance plan, but the thing of it is, the government will pay the Medicaid.
Government pay the Medicaid, but ultimately the government runs the insurance companies out of business.
Right.
We have a government.
Yeah.
Well, that's the goal.
We got the time here, it's gone past, but maybe take 10 more minutes so we can get out of
Can
here.
I make one clarifying statement?
Okay.
I just talked to my wife. It was in the newspaper.
Speak up.
It was in the newspaper about the laying off of those 4 people. So I just wanted to clarify that that was wrong.
Done.
I just, one of the issues that we haven't addressed is, if you're elected, how are you going to deal with the trillion-dollar deficits for as far as we can see? Because that is ultimately the failure of this country is going to occur if we can't afford the debt. So what is your plan to deal with the government's expansion and the debt that we see in the future?
My plan is very simple. Say no to increased spending and work for reductions in spending.